Hello friends, welcome back to our YouTube channel Doctor's Corner. Today in this particular video we are going to discuss about very important topic, that is the next exam, that is NEXT, that is the National Exit Test. Okay, so we all were eagerly waiting for the guidelines to be given by the NMC, that is the National Medical Commission. So finally on the 28th of December a circular was released on the NMC website stating the details of this next exam. I'll just brief what exactly is there in that circular and what exactly this next exam will be, and in how many steps this next exam, and what will be the duration of the exam, and what is the pattern of the exam and the marks of exam. And also we'll discuss for which batch of the MBBS will going to appear for this next exam, and what is the value of this next exam, what is the value of the marks obtained of this obtained in this next exam. Okay, so we are going to discuss in detail about this next exam. So before that I'd like to clear one thing, that this next exam in this NMC website there is a draft regulation given. Okay, just it is a draft regulation. That means it is not the gazette, so they can change few rules based on the suggestion received. Okay, there is a public notice given in the form of this draft regulation, but however in the draft regulation they have NMC has revealed full details about this next exam, how it will be, what are the marks, what is the pattern, everything, which I am going to brief in this particular video. So first of all, next exam, that is the National Exit Test, it will be in the two steps, step 1 and step 2. Okay, step 1 and step 2. So step 1 is basically will be a MCQ exam. Okay, MCQ or the objective based exam, that is a theory exam, and step 2 is a practical exam. Okay, this will be an MCQ exam and step 2 will be a practical exam. Now there are few interesting points here about this next exam. Okay, when exactly this step 1 exam will come and what is the value. So basically this next exam, that is the step 1 and step 2 together, what is the value for this, and more specifically this next step 1, that is MCQ exam. So it is mainly for two purposes. So this next exam, that is the National Exit Test, will serve two purposes. First is it will act as a licensing exam. What do you mean by that licensing exam? That is to practice modern medicine in India, that is to practice the allopathic medicine, so-called MBBS graduates, or now more specifically Indian medical graduate, according to the draft regulation of GMER, that is the Graduate Medical Education Regulations of 2019. So according to this regulation, new CBME syllabus was proposed. CBME, that is the competency based medical education, and all the subjects were divided into the competency based medical competencies, right? And each medical undergraduate has to fulfill that so-called competencies to be capable to get the to get the degree, so-called MBBS or Indian medical graduate. Now, so for our MBBS undergraduates, that is approximately till now there are, according to NMC website, there are 650 medical colleges all over India and nearly 90,000 MBBS seats available, right? So this 90,000 doctors, when they complete their third phase part 1, okay, complete the third phase part 1 and they enter the third phase part 2, that is the final year, that is the final year when they enter and they complete that. After that third phase part 2, generally earlier there was only 4 subjects: medicine, surgery, pediatrics and OBG, right? So the student earlier they used to pass theory examination as well as a practical examination, which was governed by the health universities of various states, right? Now all over India, instead of the third phase part first theory exams, okay, please give your kind concentration, instead of this third phase part first theory exam, so this is scrapped now when this next exam will be applicable. Okay, when it will be applicable, still we have no clarity about that, when exactly, in which year it will be applicable, but whatever it may be, whenever this next exam will come in force, at that time the third phase part 2 theory exam, that is earlier the senior batches whom you used to write this 4 theory exams for 100 marks, paper 1, paper 2 in general medicine, general surgery, pediatrics and OBG. Now the theory exam will not be there as per this circular. Okay, I'll just show that circular also, what the guidelines have been given in that circular. Just I am giving the summary of that circular beforehand. Okay, now but the practical exam will be there. Practical exam conducted by the state university will be there. Okay, by the state health university, whatever practical examination under general medicine, general surgery, pediatric and OBG. Now one more interesting thing I want to bring here. So from the current batch, that is 2022 admission MBBS students, as well as last year batch 2021, NMC has very clearly given the guidelines and the timeline when they are going to complete the third phase part 2. So as per the latest guidelines of 2022 batch, in my previous video I have given the full details regarding the syllabus of the MBBS and all. So according to that, there are 17.5 months in this MBBS part 2, and a student need to study the 6 subjects, that is the general medicine, general surgery, OBG, pediatrics and ophthalmology and ENT, that is otorhinolaryngology. Okay, now these 6 subjects, for the same 6 subjects one has to write this step 1 examination. I'll come to in detail about what exactly, how many marks will be there, which subjects to be will be covered in this next step 1 and this step 2 in detail. We are going to discuss in this particular video. Time being, remember what is the significance. So first and foremost significance is, it is the licensing exam to pass the modern to practice the modern medicine, that is the allopathic medicine in India. That is like any medical graduate who passes this, then only he or she will be able to practice this. Okay, they will get a provisional provisional registration certificate to practice as an intern after passing the step 1, and after passing the step 2 they will be registered under the National Medical Register or State Medical Register. Now secondly, what is the purpose of this exam is, second and the most important purpose is, it will act the scores obtained in this next part 1 MCQ theory exams or the objective type exam. So the second most important objective or the application or the purpose of this exam is, it will act as a PG entrance exam. PG entrance exam, that is earlier there was something known as PGNEET, like UG NEET, postgraduate NEET, to get admissions in the broad specialities of MD and MS, like MD in internal or general medicine, MS in general surgery, MS orthopedics, MD anesthesia, MD skin, MD radiology, so and so. So in the broad specialities of MD and MS, to get an admission, so there was an entrance exam so called as PG NEET exam. So when this next exam will come in force, then there will be no PG NEET. Okay, so this will get scrapped. So 2 exams will get scrapped when this NEET exam will come in force. That is, when this when this next exam will come, then this theory exam of MBBS third phase part 2 conducted by the universities will no longer will be there, and the scores of this will be considered as the final theory marks as well as the licensing exam, and also for the PG entrance, and also for the foreign medical graduates, those who have completed their degrees, medical degrees in various countries recognized by the National Medical Commission. For them to practice allopathy or the modern medicine in India, they need to clear a foreign medical graduate examination. The same will be now replaced by this next step 1. Okay, Hope the concept is clear about the next step 1 and step 2. I am going to discuss in detail now. So step 1, mainly it will act as a licensing exam for the Indian graduates as well as the foreign medical graduates to practice modern medicine in India, and secondly it will serve as a PG entrance exam. The ranking for the PG entrance exam in all over India and state level, it will be given based on the scores scored in the next step 1. Okay, now we'll go in detail about the next step 1 first. So this next step 1, how many subjects will be there, what will be the duration of the exam, and what will be the marks allotted to that. Okay, so next step 1, as I said, it is a objective type, mostly MCQ exam, and totally it will have around 540 marks divided into 6 subjects. What are that 6 subjects? Okay, what are that 6 subjects? I'll just pen down here. So that 6 subjects which will be covered in this next step 1 is medicine and its allied branches like skin, radiology, psychiatry, so and so. Okay, then medicine and allied branches, then surgery, general surgery and allied branches like orthopedics, then pediatrics, or before that I'll write OBG, okay, obstetric and gynecology, then pediatrics. Okay, pediatrics. Earlier in the final MBBS only these 4 subjects were there. Now for this current batch 2021 and 22, NMC has given a very clear guidelines that in the final MBBS 2 more subjects will be taught, which was earlier taught in the third phase part 1, that is ophthalmology and ENT. Okay, so this will also be there in the final MBBS part 2 instead of part 1, ophthalmology, okay, and otorhinolaryngology, that is ENT. Okay, so now totally there will be 6 subjects in the next step 1, that is 6 paper. Okay, and these 6 papers, the division of the marks is as follows. So general medicine and its allied branches or allied subjects will cover 120 marks. It is for 120 marks 1 paper. And surgery, general surgery and its allied subjects will have 120 marks. OBG will have, obstetric and gynecology will have 120 marks. Then pediatrics will have 60 marks, ophthalmology 60 marks, and ENT or otorhinolaryngology again 60 marks. So if we calculate 120, 120, 120, it is 360, 60, 60, 60, 180, 320 plus 360 plus 180, it is 540. So totally there will be 540 marks. Now will this 540 marks exam will be there only in 1 day? No. So as per the circular given, this 6 papers to be given in a duration of 5 days. Okay, so in the first day, general medicine and its applied or its allied branches, there will be exam for 120 marks and the duration will be for 3 hours. Okay, duration will be there for the 3 hours. Okay, suppose I'm just giving an arbitrary time, NMC has not specified exact time. So for example, it is from 9 AM to 12 PM, okay, for 3 hours. After that there will be a break in the day one. There will be 120 marks general medicine and its allied branches, 120 marks paper MCQ for 3 hours. Then after that there will be a break of 2 hours. Then again there will be 1.5 hours, that is 1.5 hour pediatric, okay, 1.5 hours pediatric exam for 60 marks. Okay, then surgery, then there will be gap for 1 day. Okay, second day there will be no exam. Then on the third day again there will be 120 marks surgery, 120 marks surgery for 3 hours, 120 marks surgery for 3 hours. Then after that ENT 2 hours break, and then again 1.5 hours ENT. Then this is on the third day. Then on the fourth day there will be a rest day. Then on the fifth day again for 3 hours, there will be 120 marks OBG paper followed by a break of 2 hours, and again there will be 60 marks 1.5 hours ophthalmology. So these 6 papers will be covered, or the exam will be for nearly 5 days. In that 2 days is just a rest day, and 3 days will have 2 subjects each, okay, and totally it will be 540 marks. Now what about the other pre-para clinical branches like anatomy, physiology, biochemistry, pharmacology, microbiology, pathology, community medicine, forensic medicine? So they have given the clear guidelines that these subjects, that is these basic subjects, for example community medicine is a very important subject. 10% of these questions in this, all these subjects will be related to community medicines, okay, the applied aspect of the community medicine like health programs and other things in these subjects. And also 10% of the total marks in all these subjects will be from the basic pre and para clinical subjects, okay, that is from the anatomy, physiology, biochemistry, pathology, microbiology, pharmacology and other branches, okay, like pharmacology and forensic medicine, okay. So totally 20% are reserved for this pre-para. So you need not study only the 6 subjects, ultimately you are studying all the subjects. So medicine allied branches includes all: skin, radiology, psychiatry, surgery will include, so orthopedics, everything, okay. So all the subjects will be covered, that is nearly 19 subjects will be there till your first MBBS to final MBBS part 2. So all that 19 subjects questions will be covered. However, the proportion of the questions will be more stressed, more will be 80% will be more on from this 6 major subjects which need to be studied in the final MBBS for a duration of around 17.5 months for this current 2022 batch, okay. I have given a clear syllabus in detail, it is clear guidelines from the NMC in the last video. Just please go through my last video on the MBBS syllabus, okay. So this is about the next one, okay. Now what if someone fails in one of this subject, and what is the criteria to pass? So the criteria for passing in this is you should score more than 50% of the marks in all these subjects separately. For example, 120 marks medicine means you should score minimum 60 marks in medicine separately, surgery separately, OBG 60, pediatrics 30 separately. So minimum 50% of the marks are required to pass this. And what about if someone fails in 1 or the 2 or 3 subjects here? So if someone is failing in this 6 subjects, then they have a chance to appear something known as supplementary examination, okay, supplementary examination, okay. Now what is the timeline? When exactly during the curriculum of the MBBS this next exam step 1 will come? So this timeline is before the university practical examination. So generally after the completion of the MBBS third phase part 2, that is total duration of 4.5 hours of the MBBS course, there was theory exam and practical exam. Now instead of theory exam, this next exam will be there, objective type, all over India, online exam it will be there for a total duration of 5 days including 2 rest days, okay, for 540 marks. Then after that there will be a practical examination after this next one. So after your third MBBS part 2 you will appear for the next one, then after that you will appear the practical examination of the university. So as usual, all the state health university, what they used to conduct their practical examinations, okay, practical examinations of medicine, surgery, OBG, pediatric, ENT, ophthalmology, the same practical examination based on the OSCE, that is the objective structured clinical examination standard. Objectively practical examination will be there, and if a student passes successfully, that is 50% in this next one, and passes this practical examination, then they will get a provisional registration to practice modern medicine, that is allopathy, in India as an intern. So after that the next step will be they will be undergoing 1 year internship. So still next 2 has not come, so next one plus practical examination of the university, so 1 year internship, So after 1 year of completion of successful compulsory internship, 1 year of internship, so the next step will be the next two. Okay, so next two will be basically a practical exam, and in that again this six subjects of the next two, that is this one, medicine, surgery, OBG, pediatric, ophthalmology, otolaryngology, plus one more, the seventh subject will be there, plus orthopedics and physical rehabilitation. Okay, the 7 subjects next to practical examination will be there, orthopedics plus physical rehabilitation medicine. Okay, so next two will cover totally 7 subjects and next one 6 subjects. Okay, and but include, however, it will include the allied branches, applied aspect also. So 7 subjects in that next to practical examination. Basically it will be demonstration and it will be just pass or fail. Okay, there will be no scoring here, pass or fail. If someone successfully passes this next two, then they will get a permanent registration number to practice the modern medicine or the allopathy in India. Then after that next two, this next one score which was obtained, that is the aggregate of all the 6 subjects, that score will be taken for the all India ranking for the PG entrance examination for the broad specialty MD/MS admission, that is the Institute of PGNEET. The same marks before internship, this next exam which one has appeared earlier before internship, that same marks will be for the ranking. Now what about the person who has failed and appeared for the supplementary examination? So they will take the total marks of the subjects in which they have passed either in the regular or supplementary examination. Now how many attempts are there for to appear for this next exam? There is no limit. You can appear n number of attempts. Okay, but thing is you should complete this next one and next two within 10 years after taking the admission in MBBS. For example, if a student has taken admission of MBBS in November 2022, then in the next November 2032, by that they should complete this next one and next two. That's the upper limit given. In between, that is 4.5 years plus 1 year internship, that is you will get roughly 4.5 years window to complete this thing. So indirectly they are saying within that next 4.5 years you have to complete this or else leave the course. That is maximum 10 years they have given the limit. Okay, so this is all about this next exam, step 1 and step 2. Then again they have given so many details about the ranking in the PG entrance examination. So you have even the chance to improve your score. If suppose you are getting you have passed but your score is less and your ranking is less and you want to improve your score, you can appear for the next exam next year. If again still it is there, again you can appear. There is no limit. Okay, but thing is they will take the average of the last 3 appeared exams. Okay, so average score, so in the last 3 appeared exams of the next one, and finally based on that average result they will allot you the rankings. Okay, so I'll just show you the circular released by the National Medical Commission. So this is available on the website www.nmc.org, dated 28th December 2022. So according to this, it is a public notice. So they have given all the details which I have just now briefed. So in the next step 1, this following subjects to be studied. I'll just zoom it. So this will be 6 papers covering all the third MBBS, final MBBS part 1 and part 2 subjects. That is this 6 subjects plus applied aspect of all subjects covered in first MBBS and second MBBS, and applied aspects of all subjects covered in third MBBS final part 1, that is community medicine and forensic medicine 2. Okay, that is about the next one. Then next to practical examination, this extra thing is orthopedics and physical medicine and rehabilitation. Okay, So 7 papers in next 2, and in next one only 6 papers. Okay, now the nature of the scoring and the marks also they have given. So to pass you have to score minimum 50%. The minimum marks for passing shall be 50% or half of the maximum possible raw score for next step 1. Raw score here means, suppose if there is a negative marking, I don't know whether there is a negative and all, whatever, they are still not given the details about the negative or markings will be there or not, but if it is in points and all, so it will be rounded off to the whole number, so that is known as raw score. Okay, then how they will determine the merit on the purpose for the postgraduate specialties, they have given this 4 points in that. So total marks for the is based on the scores of the next 1 exam only. Okay, next 2 exam marks will not be there, only pass or fail criteria. In case of the you can reappear, and there will be in the last 3 consecutive scores will be considered. Okay, so this last 3 consecutive scores will be considered. Here they have given last 3 consecutive scores. Okay, mean of last 3 consecutive scores. Then what is the usefulness for this? I have already said, to practice modern medicine in India, also for medical graduates, and also for the PG entrance examination. Again they have given the same things. Then one more here, the questions, how the questions will be it be very easy questions or what? They have given very clearly what type of questions will be asked based on the knowledge level. So problem solving and analytical skill questions. Okay, problem solving and the analytical skill questions will be there. So this one, problem solving and analytical skill types question. Okay, analytical skill type questions will be asked for 65%. That is, out of the 100% questions, 65% questions will be problem solving and analytical skill type. Now what is this problem solving or analytical skill type is? It will be like a case study. A patient comes to you with particular investigations or some symptoms, and what could be your possible diagnosis based on this investigation and symptoms. That's some complex. It will not be just a single line answer, or it will be a multiple line answer, or it could be a multiple line question itself. So you have to analyze, use your knowledge and skill and analyze the question, analyze the situation, and you have to answer it. Then after that, comprehension or the explanatory type will be 25%, and recall type questions will be just around 10%. Recall type means a single line word. If this one, most common drug used in a particular disease, most common side effect, okay, most common cause for this particular disease, so and so. And the level of knowledge, must know will be 60%. questions will be from the must know, nice to know 30%, and may know, difficult questions will be just 10%. So they have given the same thing. I have just already outlined this one, how there will be the 60, they have mentioned as items, 120 items. That will be just 120 questions instead of items. I have used the word questions for a duration of 3 hours for this major subjects, and 60 questions or items for 1.5 hours for this smaller subjects like pediatric, otorhinolaryngology and ophthalmology. And what will be the schedule for this 5 days? I have already outlined this. Schedule will be first day medicine and allied subjects, then there is a break for 2 hours, then pediatrics, then surgery and applied aspect, the alternate day, that is 1 day rest, then like for 3 hours, then 2 hours rest, break, and then otorhinolaryngology for 1.5 hours, then OBG after a day of rest for 3 hours, then 2 hours break, then ophthalmology for 1.5 hours. Okay, so this is the pattern or proposed time schedule for these papers. That is totally for 5 days. This exam is going to be an online exam for 5 days, which includes 2 days rest. Okay, now about the step 2, that is the OSCE, objective structured clinical examination. Okay, so this is the standard objective examination, and these 7 subjects will be there, and the time schedule also they have mentioned roughly. That is, whenever they will start this next step 1, it will be from the 2nd week of December, and the date of result should be from the 2nd week of January. They have proposed all the timeline, and finally the broad specialty postgraduate course of MD MS to start from the 1st July of that particular year. Okay, so this is all about next exam in this particular video. If you like our video, please share this and also subscribe our channel. Thank you.